No, we have no apologies for absence.
Thank you. Any declarations of interest? Members are asked to declare any disclosable pecuniary or affected interest and the nature of that interest, including the existence and nature of the party whip, in respect of any matter to be considered at this meeting. Any member with a disclosable pecuniary interest in the matter should withdraw from the meeting when the matter is under consideration and should notify the Democratic Services Officer in attendance that they are withdrawing as they have such an interest. If the disclosable pecuniary interest is not entered onto the register of members' interest, the monitoring officer must be notified of the interest within 28 days. Any member with an affected interest in the matter must disclose the interest to the meeting. There is no requirement to withdraw from the meeting when the interest is only an affected interest, but the monitoring officer should be notified of the interest if not previously notified within 28 days of the meeting. Affects nobody, no? Okay. Thank you. Can I confirm the minutes of the previous meeting are correct, or are there any amendments?
Chair, there's some amendments. The last meeting held on the 23rd of November is still showing us as expected rather than the fact that we were present at the meeting. And that is the same for the previous meeting that we had on the 8th of November. So it's not showing on our attendance record as actually being present in either of those two meetings.
I can look into that for you and get that sorted.
Thank you.
Thank you. So I'd like to invite Rebecca Williams, who is the consultant in public health, to be able to go through some slides and explain where we are with sexual health in the borough, please.
Thanks very much. I'll share my screen, and thankfully you've done this in Teams, because last time I presented to something, it was in Zoom and nothing worked. So I'm very grateful for that. Let me just share my slides. Can you see those okay? Because I know sometimes they're in a small view.
Yes, thank you.
Yeah, okay. Lovely. So this first slide I've put on the screen is a little out of date, because you may be aware we no longer have clinical commissioning groups. We now have integrated care boards. But this is the most recent diagram that summarises the fact that in the United Kingdom, there are local authority commissioning responsibilities for sexual health and NHS responsibilities for sexual health. And that's for the actual services. So the point at which someone has a sexual health need that they need to get some help for. And the main reason I emphasise this is that particularly when it comes to accessing advice about women in particular, their reproductive health, choices around family planning and access to contraception, most of that is delivered by general practices under their core contracts still with NHS England, and access to things like oral contraceptives. And currently in England, about 70% of women access their contraception through that setting. Local authorities are mainly responsible through their funding from the public health grant monies to put in place what we call specialist sexual health services, which locally we have Berkshire Healthcare Foundation Trust currently delivering that service, and I'll explain a bit more on that in a second. And also long-acting reversible contraception, so things like intrauterine devices, which typically we commission general practices to provide in addition to their core contracted activity. And then some local authorities, in addition to that, might also commission things like young people's outreach services, HIV prevention campaigns, that sort of thing. Now, in addition to that commissioning landscape, which, as I say, describes the kind of sexual health services, those that are for people when they've actually got a sexual health related or contraception related need, there's a range of other services and settings that are involved in supporting good sexual health. And the model I've shown here is taken from the National Teenage Pregnancy Framework. Common needs across our life course for good sexual health include access to high quality, trustworthy information, which hopefully negates the need or reduces the need for people to ever need an STI test, and to help them make informed choices about when and where to access contraception. That's partly just to help people maintain good sexual reproductive health, but also to help reduce the need for them to actually need to access a sexual health service. Another common need to everyone is reducing stigma around sexual health. For example, in the teenage pregnancy framework, they describe there should be no wrong door for any young person. So if they have a trusted adult, it doesn't have to be in a specialist sexual health setting. It should be anywhere actually that they feel able and comfortable to seek advice about their contraceptive needs or about their sexual health needs, and for those professionals to be able to, in an informed way, be able to signpost them if they need more support. In addition to those things I mentioned, particularly for young people, we know that we need access to good quality sex and relationship education, which is now mandatory both in primary and secondary schools, alongside support for parents to help them have conversations if they feel able to with their children, and also looking at other youth-friendly settings where it might be appropriate to provide access to things like condoms, advice about contraception. So there's a whole system around this, I suppose, is what I'm saying, outside of what we might consider a core sexual health setting. Now in Bracknell Forest, so this view I've taken from Fingertips, and I'll happily sit down with any of you if you want to explore this tool. It's a publicly available tool at any point. But these are the key indicators that they use to look at sexual health outcomes in a local authority area. So this is the most up-to-date snapshot data you'll see. Now, if the indicator's green, if you've got a green dot, it means that Bracknell Forest are performing statistically significantly better than either the England average or the benchmark, whichever's relevant to that indicator. If you're yellow or blue, you're roughly similar, which means there's no statistically significant difference, broadly in line with, as I say, the national average or the national indicator. And if it's red, it's statistically significant worse. So given this is an overview and scrutiny committee, I'll point at the red dots. So where Bracknell aren't doing as well, and actually for quite a few years now haven't been doing as well, is a metric around chlamydia detection rate, where we're significantly worse than the benchmark. So nationally, we're aiming to get over 3,250 females aged 15 to 24 per 100,000 detections for chlamydia. And in Bracknell, currently, we're at 83. Sorry, the value, that's the count. The value is 1,280, so quite significantly below. And when it comes to the proportion of young people aged 15 to 24 who've been screened for chlamydia, that we're much lower than the national average. So that's how that one's measured. So in Bracknell, 11.2% of the young people of that age have been screened, and in England, 15.2%. So that is an area we need to do much better on, and I'll come on to that later when we describe the services. The other one is late HIV diagnosis, where we're significantly worse than the national target, which is to have under 25% of people newly diagnosed with HIV diagnosed late. In Bracknell Forest and other areas in the southeast of England, similar to Bracknell Forest, the challenge we have is that because the prevalence of HIV is so low, it only takes a small number of new diagnoses to shift that indicator quite dramatically. So we do see fluctuations, but it is another area where we need to work harder to identify those relatively small numbers of people locally who are living with HIV who don't know that they have that condition. So this next slide describes the current core sexual health services in Bracknell Forest. So as I mentioned earlier, all local authorities have to commission a specialist integrated sexual reproductive health provider. Locally, that's Berkshire Healthcare Foundation Trust. Now, those specialist providers are the only ones qualified and with the staffing appropriate to provide what we call level 3 or tier 3 sexual health services. Locally, our tier 3 sites based at the Garden Clinic in Slough. Those services are a bit like certain cancer treatment sites or any other kind of super highly specialised clinical site, in this case for things like complex sexually transmitted infections, recurring infections, things like syphilis, and also long-acting reversible contraception, fits or removals for women who've tried in another setting and for whatever reason, potentially their biology, it's not been possible. So they need a specialist doctor basically to do that. And typically the specialist providers also provide much of the local tier 2 services, basically because, again, they tend to employ the staffing and have the facilities necessary to provide sexual health services. So we have in Bracknell Forest the Skimpert Hill Health Centre open 2 days a week, in addition to the access in Slough, and there's also a site in Reading. And those are the sorts of places that people would go for a routine STI test if they want to go in face-to-face, or again, a long-acting reversible contraception fit if they haven't been able to access that in their GP. Now, BHFT also subcontract SH24, who are a provider of online test kits, STI test kits, I should say. They can be ordered online, currently through our local website called Safe Sex Berkshire. BHFT currently cap the number of home test kits that can be ordered to 15 a day. We did receive a complaint last year from a member of the public that they were struggling to access these test kits, and in responding to that, I searched for some benchmarking activity, either published nationally. I asked other commissioners, but currently there isn't much by way of sort of benchmarking what is the appropriate amount. And what we always need to do is make sure that we're using our resources effectively, so that we recognise there is a need to increase access, but that we also need to do that in a balanced way and make sure that there's the appropriate health promotion for members of the public that goes alongside that. The main reason currently SH24 are subcontracted by BHFT is it's part of what we call patient triage. In other words, we want to make sure that people who need the face-to-face specialist service can get an appointment, and that the people that don't, for example, they got asymptomatic, they don't have any symptoms of a sexually transmitted infection, but perhaps they're concerned they've been exposed to one. If they're happy to go online, they should be able to access that provision there. Moving on, we have GPs. 8 of the 11 in Bracknell Forest offer the long-acting reversible contraception service, and practices can refer between each other. Some don't because of their staffing mix. They don't have the appropriate staff trained to do that. We currently only have one pharmacy in Bracknell Forest offering an emergency hormonal contraceptive service for 13 to 24-year-olds. We don't have much uptake of that, and we are working to improve our pharmacy offer because in other areas they tend to be quite popular with young people. I've mentioned the Safe Sex Berkshire website. That's mostly used by 19 to 25-year-olds, largely because that's where they're signposted to by professionals, and most people use that to order their STI test kits. And finally, the youth team by Thrive have been working with 3 secondary schools to support sexual reproductive health education in schools. Of course, all schools should be offering their sexual health education. And then I've just referenced here some of the other services connected to sexual health provision locally. So BPAS provide termination of pregnancy services commissioned by the Integrated Care Board, and Frimley Healthcare Foundation Trust provide our maternity and gynaecology services. Do prompt me if I'm taking too long, by the way. I'll try and whiz through the next few. This next slide shows the numbers of Bracknell Forest residents accessing specialist sexual health services. So as I say, that's the tier 3 and tier 2 specialist providers of sexual health by provider. And you can see the red line there shows the impact of the pandemic on initially the way in which services were provided, because for most services, face-to-face appointments weren't possible. But actually, locally and nationally, we've seen that now that that provision's available, a lot of people are choosing to access that online provision rather than going to the face-to-face services where that's appropriate. Also of note for Bracknell Forest is that largely the Bracknell Forest, Skimpert Hill Health Centre was for many years the most popular site for Bracknell Forest residents to access their sexual health services. But actually, since the pandemic, we've seen an increase, relatively speaking, in access to the Slough Garden Clinic. We don't currently know why that is, but I've hypothesised it could be that the people who don't need the face-to-face appointments, who don't need the specialist care, and who therefore don't want to travel to Slough, are perhaps going online, and that the reason for the increase in Slough is it's those more complex instances where people need to go there. The next slide shows our STI testing rate. So that's the blue line, and the orange shows the positivity rate. So positivity is a percentage of the STI tests undertaken that have come back with a positive result for any sexually transmitted infection. And what generally you want to see, and there's no sort of perfect measure of this, but you want to see testing rates roughly in line with your positivity. If you have testing rates far higher than your positivity rate, it could mean either you're testing too many people, which is potentially not a very efficient use of resource, or that you're not targeting your STI tests to the populations most at risk. And if your positivity rates are much higher than your STI testing, it could mean actually you're finding lots of STIs relative to the people testing, and it could suggest unmet need. And so, as you'll see, broadly, Bracknell Forest historically, we've seen testing and positivity rates roughly in line with each other, and currently our testing rates are higher than the positivity rates. That's improved since the pandemic period. And one of the reasons I've used that is, if we think back to the previous slide, that although we know there is high public demand for more online test kits, any review of proportionally how much more we increase that by, we need to look at the resources involved and make sure we don't offer far more tests than we need to, basically. And as I say, a big part of this is making sure people use preventative methods in the first place, things like using a condom. In terms of our STI testing rates and which population groups we see higher need, it's basically in line with what we see nationally. So Bracknell's highest rates for STIs are among the 20 to 24-year-old groups, and then it's second highest among 25 to 35-year-old males and 15 to 19-year-old males. So it's fantastic to see they're coming forward to get tested. But of course, as I say, we need to also make sure that safe sexual behaviours are part of the advice given. We also see a higher proportion of sexually transmitted infection diagnosis from people from Black or Black British, mixed and white backgrounds across Berkshire East. And again, that's roughly in line with what we see nationally. And Bracknell's positivity rates are significantly lower than the national rate, but in line with comparator areas, local authority areas with a similar profile. I think I'm almost at my last slide. So this next one is a different view to the one I showed you with the line graph. This shows the percentage of Bracknell Forest residents who accessed a specialist sexual health service by provider. And the reason I've shown this slightly different view is year on year, the columns you're looking at show between 85 and 95% of Bracknell Forest residents who used a specialist sexual health service have generally gone to one of 5 key sites since 2015, and that's changed slightly over time. And again, reflecting the previous graph, the online access has dramatically changed where people go, with a reduction in both the Slough Clinic, but more markedly so in the Skimpard Hill site. And then you'll see that Reading, the Royal Berkshire Hospital site, is still used, but again, by a smaller proportion. And finally, this one is just to show a different view. This isn't about the specialist setting. This is about where people can go and access long-acting reversible contraception. So we have, as I said earlier, 8 of our 11 GP practices offering LARC in Bracknell Forest, and the map with the purple, the darker areas are where Bracknell Forest has a higher population density, and where it says GP or there's a number 2, that represents a GP practice site that are offering LARC. over near Ascot to the east of Bracknell Forest, there is a GP practice just on the border commissioned by Royal Borough of Windsor and Maidenhead that provide a LARC service too. So although there's not a GP in Bracknell there is a site in very close proximity that's not shown on this map. So generally our GPs are where we need them in terms of providing LARC. I will stop sharing because I feel like I've spoken at you for a long time, and open to answer any questions you might have or further detail you might like. Thanks for listening.
Jodie? Councillor Watts, would you like to ask a question?
Oh, please, Councillor Watts is my mother. All right, thank you, Rebecca, for the presentation. It was really good. I was just wondering, so you mentioned there's one service that provides condoms for teenagers. Is that the only one, or are there any other places they can get them?
So at the moment, we have really limited provision in terms of condom access, free condom access for young people. You might have heard of the C-Card scheme, and some areas commission lots of sites to do that. And currently, locally, we don't have an alternative provider. So young people can access it through the pharmacy that deliver the EHC. They can get it from Skimpert Hill. I believe the youth service used to offer it. I don't know if they currently are as part of their outreach service into the schools, but something that we are exploring at the moment.
Okay.
So we currently, sorry.
Is there some kind of, sorry, yeah, carry on.
I was just going to say we're currently running focus groups with young people across Berkshire East to explore where they're aware they can access services, where they would prefer to go, to try and find which settings are more appropriate. Because what we want to build is a model where whether they need an STI test or they need condoms or they need emergency contraception, they can get that in one safe space. At the moment, what we have, for example, through the schools offer, was not a fully comprehensive offer, and actually that means they're getting some of their needs met, but not necessarily everything. So we want to build something, listening to their views and in settings that they want to see those services in.
Okay. Do we? Sorry, one more question. Do we have a phone line or an online chat, something like that, where they can get sex advice?
So they can access there is a phone line that Berkshire Healthcare Foundation Trust provide, and it's on our Safe Sex Berkshire website. There is also a virtual consultation. I think it's on Thursdays, that's again on the Safe Sex Berkshire website. Again, one of the key areas for development we picked up on in our health needs assessment we ran last calendar year was the need to improve our digital offer, because some areas are offering a much stronger telemedicine service, and we're really keen to explore again how acceptable that would be for young people alongside the face-to-face appointments. So really good questions, and definitely priority areas for service development. And what we want to do is do that in an informed way, as I say, hearing from local young people in that design.
Yeah,
Thank
it's
you,
one of the things that's quite important to make us, the more the merrier. Thank you.
Councillor Cochrane?
Yes, I've got two questions. The emergency hormonal contraceptive, that needs to be called the morning after pill?
Yes.
Is it something? Oh, right, okay. The second question, are those test kits, are they free?
Yes.
They are?
Yeah, they are. And people
Okay.
can, there are lots online, there are lots of websites that can provide them where people can pay for them. Now, that's not really generally going to be accessible for lots of the population for various reasons. With the STI test kit offer online, the reason we haven't just said to BHFT, can you up the cap immediately, is that, as I say, at the moment, our positivity rates are suggesting we're roughly testing the right proportion of people, and in increasing our offer, we want to look at actually alongside that STI test kit that someone's ordered, do they need emergency hormonal contraception or a pregnancy test? Do they need some really good quality contraception advice? do they need any safeguarding? So it's the health promotion that goes alongside that offer of a kit, and it's part of this triage offer as I described. So we're reviewing best practice elsewhere, and we're working with BHFT, who you may be aware we've implemented a 2-year direct award with them. So from the 1st of July of this year, they will be expected to deliver from our new service specification, and an improved digital offer is a really key performance indicator on that we're building with them. Oh, sorry,
Lovely.
I'm going off on a tangent, but
No,
I just
that's
want to
fine.
emphasise
That was good.
important, but it goes with
that told us
everything
a lot.
else. Yeah.
Thank you
Yeah.
very much. Thank you.
Councillor Webb?
So I've got a couple of questions actually. The clinics, are they walk-in or do you have to make an appointment? I noticed you mentioned triage. So someone was feeling a bit anxious, would they have to go through the process of making an appointment or can they just walk in?
Patients can just walk in.
Right.
At Skimpard Hill, they have a walk-in appointment block just for young people. I did look at it the other day. I think it's Thursdays from 3 till 5. And then at the Slough site, there's also a young people specific one. We know from national evidence, younger people prefer to have their own bespoke appointment times and walk-in appointment times. But they're walk-ins for any age throughout the week. It might just be they have to wait, but our current key performance indicators suggest people aren't waiting. I think it's more than 30 minutes. 95% of people are not having to wait longer than that.
A second question, I know that Frimley was taken out of the for Bracknell residents from 2018. Is there any reason why that was? Because Slough and Reading are probably a little bit further away than Frimley. I know we've got Skimpard Hill, but was there any reason that they took us out of that equation?
So we haven't gotten to the bottom of that yet. We did when we earlier last year, we put out a notice to the sexual health provider market to say we're looking to go out to tender for our specialist provider service. Are you interested in bidding? And we didn't receive interest from some of the providers we expected to, including local ones in our area. I haven't gotten to the bottom of whether when Frimley stopped providing that local service, that was because they lost the staffing mix. They just decided some NHS trusts will decide it's not a priority area of business development and they're just not interested in the contract. But we have committed to deliver a process called competitive dialogue over the next 2 years. And what that means is speaking with the potential market, all our local NHS trusts, GPs, voluntary communities, a broad market. We will be going out to speak to them ask these sorts of questions, Councillor Webb, to see are they interested in and able to deliver some or all of that within 2 years' time. So yeah, sorry, I don't have a perfect answer for that, but
that's fine. Thank you very much.
Councillor Walsh?
I just have a question. Obviously, the data you were presenting went up to 2021, obviously, when we were still kind of, a lot of people were probably still a bit scared to go out. Have you noticed any trends since then? Do you have any data on the trends since then? If, you know, people are saying they can't manage to get GP appointments, you know, are they trying to find other routes?
So the data we've presented is the most up-to-date that's published. We do meet regularly with Berkshire Healthcare Foundation Trust to understand, so we meet on a quarterly basis with them to look at how they're performing and any issues arising. And they haven't said that there have been any challenges in terms of patients accessing the service. They've not seen, for example, an increase in patients trying to access their service because they can't see a GP. And we still have the same number of GP sites broadly offering LARC. Something that came up, we ran a survey among professionals last year to try and explore whether any areas they wanted to raise with us as concerns. And we used it was like a tick box. They had to rank things, and one of the things that ranked highly that we were curious about was some professionals said they were concerned about access to urgent contraceptive appointments. Now, again, we've tried to explore that with local GPs, and they're not sure what the challenge is, and the survey is anonymous, so we can't quite find the root of this. And we've also explored it with BHFT. But again, broadly, I think speaking with professionals locally, I think there's a lack of awareness among some professional groups, particularly those working with young people, where I'd really want them to be more familiar with what services are available locally, and where best to signpost people. So I wonder if part of it is a concern, like you've raised, Councillor Welsh, that perhaps the pandemic has affected access, and maybe access to urgent appointments is a challenge. But yeah, we're still open to hear from local professionals, and in fact, we're still interviewing local professionals working with vulnerable young people to understand the local picture better. Again, sorry, tell me off if I'm saying too much. I just want to give you as much detail as I can.
No, that's good. Thank you.
Councillor Watts?
Just a quick question. What qualifies as emergency contraception? Is it just the morning after pill, or are we talking abortions as well?
So emergency contraception includes the morning after pill or EHC, but long-acting reversible contraception can also be used instead in certain circumstances. Termination of pregnancy wouldn't be counted as emergency contraception. Again, I can imagine that because in Bracknell Forest and actually much of Berkshire East, we have a really low uptake of pharmacies interested in providing our EHC, emergent morning after pill service. If professionals have raised that, my suspicion is it's because they're aware that we don't have many pharmacies, and we are working with the Integrated Care Board. They have a community pharmacy lead to explore what they're doing with things like, you might have seen in the news, pharmacies can now offer oral contraceptives, so not just the morning after pill. So we're trying to build a stronger offer to try and get pharmacies interested in providing something for women, because we know for some groups that's more accessible.
Yeah, I've noticed that some of them do provide oral contraception, but you do have to you can't do it anonymously. You can't just go and buy one. You have to go and have an interview with the pharmacist, and and that can be a little bit daunting if you're a teenager, for instance. Right, thank you.
Thank you. Councillor Harrison, please.
Thank you, Councillor Eccleston. Yeah, in the report we saw earlier, there was a mention of that one of the red indicators was our level of detection of chlamydia, and one or two other things I think were in there as well, gonorrhea as well. So is this down to a reluctance of people to come forward for testing? Is it lack of information? Have we any, it won't be quantitative, but qualitative information about what that is about? Or is it just lower because we have a lower incidence and therefore people don't think they need testing?
Nationally, the reason those two indicators are used, so we've got the screening, so the percentage of the young people who are accessing a screen, and then the detection rate among females, is because the National Chlamydia Screening Programme changed a few years ago, so that it's only females who are offered what's called an opportunistic screen. So any young female going to their GP or pharmacy or specialist setting saying they have some kind of sexual health question or need, that healthcare professional should be saying, while you're here, could you do take a chlamydia screening test? The reason we look at the two together is, yes, again, one could hypothesize that actually if there's lower need, young people aren't engaging in sexual relationships or taking risks with that potentially they might not see the need to screen, and potentially we might detect less. But actually the evidence suggests we want to see a higher proportion of screening. I suppose the national target is around the detection, and that's because they think there's a lot of undiagnosed chlamydia. For a lot of people it doesn't have any symptoms, so they're keen just to get our screening rates up. The challenge we have locally is that at the moment, the only site we commission to deliver chlamydia screening is the Specialist Sexual Reproductive Health Service and our online STI test kit offer. And we have been, again, we've been exploring the role of pharmacies, for example, in broadening that offer. If you've got young people coming forward for emergency contraception, they probably should have a chlamydia screen and not just be signposted online. That's generally what the recommended national guidance is. So yes, it's a very valid hypothesis that maybe we have lower need, but the national evidence and sort of guidance suggests we should expand our screening offer, and that's what we're looking to implement as soon as we feasibly can.
Could I just ask, is that something people can self-test? They're given a kit, or is it something they need to go to a surgery and be properly seen by a professional?
They can self-test, so unless they're symptomatic. So if people are symptomatic, they need to go to the specialist sexual health service. But if they're asymptomatic, which means you haven't got any symptoms, it might be that you've had sex with someone who's declared that they've tested positive for chlamydia, or it might be that for whatever other reason you've are concerned. Yes, the home test kits basically are delivered to your home address. You do a test and then return it in the post, and then they will send the results. And our online test kits do a full screen, so they test for HIV and gonorrhea as well. Because if someone's testing, they're concerned they've contracted an STI, we want to make sure we're covering all bases there.
Councillor Watts.
Hello, me again. Who is the group that goes round to the secondary schools and does sex ed? And are we in communication with them? And do we know if they need any more support?
Yeah, so it's at the moment it's Bracknell Forest's youth service who do that outreach offer, and the Bracknell Forest Public Health team have been working alongside them to look at how we redesign the current offer. So broadly, they've been offering, as I say, I think at some point, if they aren't currently, they're accessing, providing access to condoms and sexual health promotion advice, signposting to contraception. And they did at times have a clinician going in to offer some contraception, although the uptake, the demand for that was fairly low. Berkshire Healthcare Foundation Trust are now working with the youth service to implement some on-site contraception. But part of what we're trying to move towards is a more sustainable and more comprehensive model, because, for example, the previous one didn't provide any access to things like sexually transmitted infection testing. And also, although young people might have been accessing oral contraception or EHC, they wouldn't in that setting be able to provide long-acting reversible contraception, which is more effective. So as I say, our priority at the moment is working with young people locally to understand where they go, where they'd want to go, and think what is the most appropriate settings to provide access to a range of services. And as I say, it ranges everything from health promotion. And I say, for me, the main priority is understanding and enhancing our offer in schools. The Teenage Pregnancy Framework recognises that as a key pillar. And at the moment, speaking with local professionals, I really haven't got much of a sense of that relationship between the council and local schools, what support they need. Keen to embed it if we have any kind of healthy schools offer, if we're working alongside the schools, that we don't stigmatise sexual health, we include it. But that outside of that, we look at the other options, things like online offer, things like pharmacy, things like youth-friendly settings, whatever they might be, as I say, to deliver a more comprehensive service than perhaps what was in place previously.
Just on the youth service again, do you know if they're offering any kind of, like, I mean, when my eldest was in secondary school, there was literally no education, sex education regarding same-sex couples. Have they changed that recently? Is there an offer for children who, want to know more about that?
That's a really good question. And I don't know the answer, as in I don't know if it's part of the core curriculum for PSHE, or what I do know is the youth service have been working with the schools, the 3 sites that they've been going into, to support them in delivery of the core curriculum. But I'd be happy to come back with you. The answer will lie in whatever's the nationally recommended core curriculum for for sexual reproductive health education. What we do have on our local Safe Sex Berkshire website, which is the one we've designed many moons ago to offer some kind of local health promotion advice, is we do have some links to things like gender identity and sexuality, and also there's a Frimley integrated care board site, a public facing one, where I've also noticed they've got some information about things like sexuality. Again, I don't want to go off on a tangent or give you too much detail, but part of us exploring our digital offer, I've got one of my foundation doctors working at the moment to look at what websites and what health promotion available is online, because there are some absolutely fantastic websites, places like Brook and other specialist voluntary sector organisations who've got much better and better maintained information, and how do we signpost young people to that support. But in schools, I'd have to check the curriculum.
Okay, I'd be interested in that. It's a personal family subject, so I'm quite invested in that. So if there's anything more that I can help with after the meeting, then yeah, let me know.
Thank you,
That was
Rebecca.
it.
That's really informative. Can I just ask you a quick question, please? So when people go and they've ordered their test, it then perhaps comes back negative, so nothing needs to be done. At that point, does it get flagged up anywhere that somebody has actually requested this, and it might be having unprotected sex and could be actually sort of encouraged to have better contraception? Or is it just, though, that's a negative and that's where it's left?
So if someone has a positive result, they'll get contacted and followed up. If it's negative, then that's the end of the pathway. That's partly in response to the levels of demand we see. But it's also because I suppose the health promotion bit has to go alongside the fact that someone's ordered an STI test kit. So at the point that they're trying to order that, and again, I keep using the word triage, but really if someone's trying to click online and click, I think I need an STI test kit, it's at that point really that the question should be posed, actually, do you also need contraception, and here's where you should go. I do take your point about kind of, you don't want someone to have a negative result, but they've still been at risk, and then where have they gone on to next? But as I say, I think broadly it's I'll go back to what I said at the start of my presentation. I think it's about making sure, threaded throughout our services where appropriate, we use making every contact out, making every contact count, we destigmatize healthy sexual behaviours, healthy sexual relationships, and that when people are approaching what is basically our specialist service, we use that as a key moment for health promotion to say, oh, hang on a minute, have you thought about safe sex behaviours and what other needs you might have?
Thank you. Has anyone else got any other questions for Rebecca? Sophie, sorry.
Hello there. No, you're fine. Sorry, and this was maybe offered a bit of a tangent just listening, and I apologise. I don't manage to make it to these meetings very often because of the nature of my other job. There's a lot of focus, and rightly so, on the youth access to sexual health. But my understanding is that actually our highest growing part of the community that's actually contracting STIs is actually people of probably my age and older, where they're coming out of long-term relationships and going into the next relationship, and they have not had the education perhaps when they were at school. And certainly when I was at school, it was all about HIV and it was hugely stigmatized. And so there was a lot of reticence about talking about STIs. What are we doing to help? I don't know what's the correct way to put it. People of my age and above, perhaps, and getting them signposted to support and where they can get it.
Thank you, Councillor Forster. That's a really important point, and you're quite right. So although the absolute numbers of STIs we see in middle and later life, however we want to define later in the life course, let's say, beyond youth, the highest growth in terms of STIs is among the later parts of our life course for a range of reasons. Now, at the moment, we don't have any local strategy specifically targeting that age group, but what I am familiar with is There are areas in the country that are developing good practice. There's a project called Shift, specifically, which has looked at actually how can you improve the offer, and it is all about that health promotion opportunity. As you've quite rightly described, are people even going to recognise they have a sexual health need unless they're symptomatic? And again, I don't want to sound like a broken record on this, but I think part of what we need to do next, so as I mentioned last year, we focused on doing this health needs assessment process to look at current evidence and look at our STI testing and contraception access, etc., etc. This year, we're focusing on building the strategy that responds to that. And we did take what we call a life course approach, so looking at every age group, every stage of life, what do we need to be doing? So we won't miss those other age groups. Children and young people is a priority at the moment because we've found that's sort of one of the priority areas. It's a gap. But the point you've raised, Councillor Forster, is spot on, really important. And I think broadly what I'm saying is our approach will be to look at those opportune moments to thread it through and destigmatize the idea that, you know, in starting a new relationship, make sure you're using a condom, check in with your partner about their other sexual partners, etc., etc. Those things that maybe people haven't been educated on before.
Certainly, you know, my kids seem to be far more aware of the need to be sexually sensible, and you know, they're not. Well, I don't know. One is 18, maybe is sexually active. I've absolutely no idea. But then I was certainly never made aware of needs and to be being checked and going for tests and things. So there's a gap somewhere. Anyway, thank you.
Thank you, Rebecca, for your input tonight. I think we've all found it really interesting, and it's given us a lot of ideas, and it's also helped us raise those questions, but with the information that you've so eloquently given to us. So we do thank you very much for that and your time tonight as well.
It's been a pleasure. And if anyone does have any specific questions, they'd like to come back to me on, I'll put my email in the chat simply because I've got an odd surname and I don't want you to miss me. And Councillor Watts, I'll come back with you specifically on your query, but anything else, happy, and Councillor Forster too. I'll follow up on those queries. So I'll put my name in the chat, and then unless you need me, I'll drop off the call.
Lovely. Thank you very much for your time this evening.
Thank you.
Thank you. So if we move on to the next agenda item, which is our draft sexual health scope. Esther, is it possible you could share that if you've got it handy at all, please?
Yeah, I'll do that now.
Thank you. So I don't know if everyone's had a chance to look at this, but this is basically what we're going to be looking at. We've sort of had it, the reasons explained why we're going to do the review with the numbers. And our objectives are going to be to identify the reasons why residents, particularly those under 25, do not use specialist contraceptive service, understand the impact, if any, of the lack of dedicated special sexual health service in the borough, and understand how specialist contraceptive services work, which serve Bracknell Forest residents. Understand how specialist contraceptive services and partners work together to promote and improve services, and assess their impact. Identify the reasons for the detection rate of chlamydia and other sexually transmitted diseases is lower than other local authorities. Now we're going to do that by carrying out a desktop analysis of public health data, for example, Joint Needs Strategic Assessment and NHS digital data where available online, visiting specialist contraceptive services which serve Bracknell Forest residents, interview service commissioners and operational delivery managers, interview comparator local authorities with better detection rates, and talking to residents to capture their views. Has anyone got any comments on that, or would they like to add to the scope?
No, I think it's looking pretty good so far. Yeah.
Would anyone else like to comment on it? Is everyone happy with it? Would they like to add to it?
I think it's fairly sensible.
Yep.
Yep.
And I think it would be a useful bit of help for the council to look at this. So no objection to it. Let's go ahead.
Excellent. Councillor Webb?
Sorry. I think it looks good. The only thing I made a note of was that Rebecca says something about lack of provision for the morning after pill because of the lack of pharmacies. I know that's probably another add-on, but it's something that needs to be brought in, I think, because that's obviously it's affecting the services. That's what I'm saying. Yeah.
Yeah, fully
I
agree with you.
Yeah.
Yeah, sorry, I agree with Jerry on that. Yeah. Otherwise it's good, yeah.
Yeah, I know we've already mentioned it, but reviewing PSHE, I can't tell you how much I really want to get LGBT involved in that, because if you teach it to a group, then the ones that want to know these things but don't want to be singled out will have the information without having to go looking for it, and then thus declaring themselves. So I mean, a lot of schools these days have LGBT clubs and everything, but you can't go there if you're not out. So it's really important that it's part of the PSHE, because then it's like it's a broad spectrum thing. Everyone gets it, and yeah. Sorry, I'm not going to go off on a rant. If anybody wants to hear me rant, feel free to email me. I will rant. Had lots of experience at this.
Thank you, Councillor Watts. We'll wait to see what the feedback is from what happens regarding the education in schools, and then we can work from there once we've got that data and all the proper information on it.
Thank you.
So, thank you.
I was going to say, I'll also look at what the current curriculum margin is supposed to be.
Yes, certainly. So we've sort of agreed that's absolutely fine as it is, but also to find out why we've got so few pharmacies willing to offer the morning after pill, and if there's any feedback we can give to encourage that within the borough, because that does seem to be an issue as well. So our last item on the agenda, I'm going to see Grenier tomorrow to discuss what we're going to do after this topic. So really, I'm just inviting any ideas that you feel that we should be bringing after this one.
Okay. Sorry, Cherie's had her hand up. I'll do it properly.
Sorry, yeah, just
Yes,
in regards to, I know we discussed about looking at Grants Bridge, about it used to be open as an urgent walk-in centre, and if that is still on the agenda to be looked at.
I will ask her about that. I mean, have been looking into Brantsbridge. I mean, obviously they take you, if you've had like an injury within 48 hours, you can go in. If it's been any longer than that, you have to go elsewhere. As far as the out of hours service, we use Boundary House more in Bracknell now, which runs till 8 o'clock at night for somebody who's got like an illness that needs to be looked at straight away. Many GPs are tied to Boundary House at the moment, but it could be something we could look at too, because obviously it doesn't offer it across the borough. Some people get appointments at 8 o'clock at night. Others have to ring 111 to be able to get that appointment at Brantsbridge. So yes, I think it's something that I will ask Grenier if we can look into it. Councillor Watts?
Why, thank you, Madam Chair. One thing to look at that came from the presentation, could we look at maybe improving the online services for teenagers wanting to ask sex questions? I've stumped you, clearly.
You have. What I can ask Grania if it's something we can look at as a review.
Yeah, it's something I think is really important because I mean, I don't want to go back to special needs schools, but in a lot of special needs schools, and like particularly the ones where the kids have been kicked out of school a lot, they miss sex ed year, and they are the more susceptible ones, the ones that are more likely to go having sex underage and not knowing what condoms are. Oh, I met a 16-year-old who didn't know what a freaking condom was. I won't go on about it, but basically the free information, ask any question, no questions asked. That's what we need. And it will also take, the pressure off sex clinics because they will know what they're doing and hopefully won't get into trouble.
Thank you.
I'll man a phone somewhere. Just give me a line.
Councillor Harrison.
Yeah, thank you. With the effects of lockdown and it having particularly bad effects, I think, on younger people, I think we ought to have a look at mental health services and the availability of that, because I think it's something that's going to be really in need over the next few years, and probably more so than it has been up until about 2019, 2020.
Exactly. Is there a particular age range you're looking at, or just overall for the borough?
I think overall, because people of all sorts of different ages were affected differently. I think it depends whether you had the support of family around you, or whether people were single and lived alone and were completely isolated by being unable to leave their homes. So I think it's really about the overall availability of the services, because I know that's been a bit of a Cinderella service in the NHS, and it's certainly not been up to the the capacity level for the demand. And I would imagine it's probably even worse now.
Exactly. That's one thing I will raise tomorrow with her. Thank you. Councillor Webb.
Right. Can you hear me?
Yes.
It's a nationwide problem at the moment, lack of dentists, especially NHS dentists. But if you've been looking at local or national news, children's teeth, so many children are being admitted to hospital to have teeth extracted. And maybe we should look at a programme to educate parents on how to help keep their children's teeth more healthy. So that although it's difficult to get a dentist, I've sort of heard that some parents are too frightened to even clean their children's teeth because they don't want to hurt them. So maybe we need to try to bring in a programme to better educate parents on how to help children have better dental hygiene.
Thank you, Jerry. Excellent. Sorry, Councillor Webb, excellent suggestion on that. I would take those ideas forward to Grania, so then I can update you at the next meeting, and we will get this scope over to the Overview and Scrutiny Commission in February for them to agree that we go forward with this, with what we've discussed tonight and what we're looking to achieve on it, with the aim of it being completed and taken to the Overview and Scrutiny Committee as completed by the end of May. So thank you for your time tonight, everyone. Hopefully we're finishing on time. If you have any questions at all, please feel free to contact myself or Esther.
Chairman,